Good afternoon, everyone. As we continue to address the unprecedented COVID-19 pandemic, some residents may have noticed that it has been a challenge for our streets department to maintain trash and recycling collection on a consistent schedule. If your trash or recycling did not get picked up, please leave it out in its normal spot for pickup. The streets department is currently 1 day behind and will be working into this weekend to make sure all trash and recyclables are collected. Residents should continue to set out their trash on their normal collection day. We thank everyone for their patience and cooperation while we work through this. Today I would like to thank City Council members for their swift consideration of ordinance number 200258 and for their unanimous final approval this morning. The measure authorizes $85.4 million to aid the city's response to the COVID-19 coronavirus pandemic. $85 million is appropriated to the Managing Director's Office, with the remaining $400,000 allocated to Council for Communications. As most of you know, we have already incurred significant unplanned expenses for a wide range of needs, including testing sites and supplies, quarantine locations, and protective equipment and supplies for frontline staff. Those needs and those costs are going to continue. The funding will also enable the city to maintain core services that Philadelphians, particularly our most vulnerable residents, rely upon during this unprecedented time while minimizing the exposure of the city's workforce to the virus. So making these funds available now is critical to protecting the health of Philadelphians, and we appreciate Council's speedy consideration and its unanimous approval. Our administration will continue to collaborate with Council to manage this difficult situation. Now I'd like to give Council President Clark the opportunity to say a few words before I sign this measure into law. Council President.
Thank you, Mr. Mayor. Mr. Mayor, I just would like to congratulate your team for your swift action, getting ahead of this. This is unfortunately the type of history that we would like not to have be a part of. But the reality is that everybody understood the nature of moving this as quickly as possible, making sure that we got this in place. And in the aftermath of this, we will do whatever we need to do to flatten this curve. So we're just asking everybody to please pay attention to the recommendations. We must flatten this curve. We talk consistently with the administration to make sure that whatever we need to do to put us in a position to win this battle, we're going to do. So Mayor, Dr. Brian, guys, thank you all very much.
Thank you, sir.
Yeah.
Doctor?
Good afternoon. I'm going to give you a brief update on where we are with the epidemic here in Philadelphia. And the summary is that we continue to see a rapid growth in cases, and the testing still is available. Our healthcare system is seeing more patients with this infection, but they're still available for everyone who needs medical care. So let me give you more numbers and more detail on that. Since this time yesterday, we have 425 new cases in Philadelphia, bringing us to 2,100 cases of the coronavirus infection since the beginning of the epidemic. That is an increase of 360 new cases that were reported yesterday. A number of people have asked for more information on the age and gender of the people who have this infection, so we are posting that on our website. It's available right now, and we'll be updating that on a daily basis. One high-level summary is that about 50% of the infections are in people under the age of 50. So this is very common among relatively young people. Now, the fatalities are in older people, but it is definitely affecting younger adults. We are seeing more clusters of this infection in group settings where people live together, such as nursing homes and behavioral health facilities. And included in that would be the city's jail. We now are up to 20 infections in inmates in the city's jail. The health department is working with all these facilities, including the city's jail, to try to contain this infection. That includes separating off people who are infected from those who are uninfected, ensuring hand washing and putting in procedures for screening staff for testing people who might be infected to identify infections early, and for putting masks on staff at all times so that if a staff person had an infection and didn't recognize it, they would not be spreading that infection to the residents. And we are also, as of yesterday, where we said we are making testing available to healthcare workers, we're expanding our definition of healthcare workers to those who work in these congregate settings, in these group residential settings. As of today, we are reporting 2 new deaths from the coronavirus infection here in Philadelphia, bringing us to a total of 17. I will give you details of the 17 by age. 1 was between the ages of 40 and 49. 2 were between the ages of 50 and 59. 9 were between the ages of 70 and 79. 4 were between the ages of 80 and 89, and 1 was over the age of 90. So overall, about 80% of these people who died were over the age of 70. Of the 17 people who died, 9 were in nursing homes, which is, again, reminding us the importance of these group settings, particularly where vulnerable people are living. For people outside that, testing is available still across the city. The same sites has been available before, about 20 sites across the region, in general by referral from a healthcare provider affiliated with those sites. In general, the testing criteria are for healthcare workers and for people over the age of 50 who have symptoms. The testing site at Citizens Bank Park is open today from 1 p.m. to 6 p.m. And the new site that we mentioned yesterday in Center City area is available and will be available 9 to 5, 7 days a week, but by appointment only. Criteria for this is, as in our other site, healthcare workers or people over the age of 50. If people meet those criteria, have symptoms, and would like to be tested there, call 267-491-5870 to talk to someone and get a referral to the site. The hospitals are preparing for the increase in patients that they are expect to see in the future. And they are already beginning to see an increase in patients with this infection in the hospital. So I will be reporting out numbers in the future that we have now getting from hospitals to the city, more across the city. So right now we have, by the hospital's report, 315 patients with the coronavirus infection in hospitals in the city of Philadelphia, and 560 patients in the entire Philadelphia region. Now, to put that in perspective, there are about 12,000 hospital beds across the Philadelphia region, so this still represents a very small fraction of the total hospital beds. When I say the region, just for clarity, that includes Philadelphia County, Bucks County, Montgomery County, Delaware County, and Chester County. We also have information from the hospitals on an ongoing basis about what percentage of their hospital beds are available. They're not currently occupied, and it's 44%. So there's still many hospital beds that are available. Their emergency departments are not busy at the moment. They're seeing about half of the number of patients that they see under ordinary times. So again, we have plenty of availability of the healthcare system right now, should people need it. But I do want to emphasize that we want to keep it that way. We want to make it so that our healthcare system does not become overloaded. That protects everybody. So just to drive home the point again, if you don't have to be outside, don't be outside. Stay at home. If you have to go outside, make sure you keep your distance from people and wash your hands plenty so that you don't spread the infection or don't acquire the infection. For more information, www.phila.gov/COVID-19 or call 1-800-722-7112. Thank you.
Buenas tardes. Según continuamos respondiendo a la pandemia del COVID-19, algunos residentes habrán notado que el ajustarse al calendario acostumbrado para el recojo de basura y artículos reciclables es un reto para nuestro departamento de calles. Si no se recogió su basura o sus artículos reciclables, por favor déjelos en el lugar acostumbrado para que se recojan. Este servicio lleva un día de retraso y trabajará el departamento este fin de semana para asegurarse de recolectar toda la basura y los artículos de reciclaje. Los residentes deben continuar sacando su basura en el lugar y el día que normalmente les corresponde. Les agradecemos a todos por su paciencia y su cooperación. Hoy quiero agradecerles a los miembros del Consejo Municipal por su pronta atención a la ordenanza municipal número 20258, que fue finalmente aprobada de forma unánime esta mañana. Esta medida autoriza la inversión de $85.400.000 para apoyar la respuesta de la ciudad ante la pandemia del coronavirus COVID-19. Se destinarán 85 millones para la oficina del director gerente y los $400.000 restantes para el Consejo Municipal. Como muchos saben ya, hemos incurrido en gastos significativos que no estaban programados para satisfacer una gama de necesidades: sitios y materiales para pruebas, espacios seguros de cuarentena, suministros y equipos de protección para el personal en las trincheras. Esas necesidades y sus costos van a seguir aumentando. Los fondos nos permitirán mantener servicios básicos de los que dependen nuestros ciudadanos, especialmente los más vulnerables, durante estos momentos cruciales, mientras tratamos de minimizar la exposición al virus para nuestros trabajadores. Por lo tanto, el liberar estos fondos ahora es crítico para proteger la salud de todos los residentes y por eso agradecemos la aprobación y consideración rápida de forma unánime del Consejo Municipal. Por supuesto que nuestra administración continuará cooperando con el Consejo para navegar esta difícil situación. Gracias. Luego viene el mensaje con respecto a la materia de la salud para el día 2 de abril del año 2020. La última información que nos proporciona la ciudad de Filadelfia indica de que hay un crecimiento continuo de los casos y que la tendencia es que sigan aumentando rápidamente. El sistema de atención médica está disponible para todas las personas que lo necesiten, independientemente del idioma que hablen, si tienen seguro médico o no, o de su estatus migratorio. Este virus no discrimina por raza o género. Desde ayer a la 1 de la tarde se han confirmado 425 casos nuevos del coronavirus en Filadelfia y actualmente tenemos 2.100 casos confirmados en la ciudad. Se observan más casos en sitios donde se concentran gran número de personas, tales como hogares de ancianos, centros de salud ocupacional y otros. Si quieren ver información sobre las edades y géneros, se puede ir al sitio web fila.gov/COVID-19. En cuanto a las cárceles, hay 20 casos confirmados entre los reclusos. La ciudad está trabajando con los operadores de los centros penitenciarios para contener el virus. El personal está utilizando el protocolo de Universal Masking, lo que significa que de ahora en adelante el plantel usará máscaras para prevenir la propagación del coronavirus COVID-19. Se está promoviendo el lavado de manos frecuente para toda la población penitenciaria y se ha expandido el criterio para administrar la prueba, que incluye en su grupo prioritario a todo el plantel que trabaja en los centros penitenciarios. Reportamos tristemente 2 nuevos fallecimientos en Filadelfia. Un total de 17 personas han muerto por el COVID-19. Esa es la información que podemos proporcionar en cuanto a estadísticas. Una persona entre los 40 a 49 años de edad, 2 personas entre los 50 a 59 años de edad, 9 personas entre 70 a 79 años de edad, 4 personas entre los 80 a 89 años de edad y una persona mayor de 90 años. 9 de las 17 muertes han sido en hogares de ancianos. Las pruebas están disponibles en la mayoría de hospitales, pero deben ser ordenadas por su médico primario o médico de cabecera. Recordemos que las pruebas deben ser administradas a personas que tienen síntomas, son trabajadores del sector salud, son trabajadores de los centros penitenciarios o tienen más de 50 años de edad. Respecto al centro de pruebas en el Citizens Bank Park, hoy estará abierto de 1 a 6 de la tarde. Con respecto al nuevo centro de pruebas en el centro de la ciudad, estará abierto de 9 a 5 de la tarde, pero solo por cita. El criterio es el mismo que para el de Citizens Bank Park: personas mayores de 50 años de edad, aquellos que presenten síntomas, trabajadores del sector salud. Si cumple usted con estas condiciones, llame al 267-491-5870. 267-491-5870. Recuerde que debe ser referido por su médico de cabecera o médico primario. Los hospitales se están preparando para el aumento de los casos. Los pacientes hospitalizados en Filadelfia para el COVID-19 son 315 en Filadelfia, 560 en la región, pero este número va en aumento. Cuando hablamos de la región, nos referimos a los condados de Filadelfia, Bucks, Montgomery, Delaware y Chester. El 44% de las camas de los hospitales están aún disponibles en la región. En Filadelfia estamos preparados para atender esa emergencia médica. Ya que los casos van en aumento, si usted no es un empleado esencial, por favor, quédese en casa. Si debe salir a trabajar, le recomendamos mantener la distancia social de 6 pies, lavarse las manos continuamente por 20 segundos y le invitamos también a consultar el sitio web para obtener mayor información: www.filia.gov/COVID. Recuerde usted que puede llamar al 311 si tiene preguntas sobre el COVID-19. Hay servicio de traducción disponible en 100 idiomas. Si tiene usted preguntas de carácter médico, puede llamar las 24 horas del día, 7 días por semana, al 1-800-722-7112. La llamada es gratuita. Gracias.
Okay, thank you. We will now move to our Q&A portion for members of the media. Just please remember, we do have limited time, so we ask for just one representative from each media outlet, and we're asking you to limit your questions to 3 or fewer. We will definitely do a second round if time permits. So for those logged in today, please use the raise your hand feature, and that can be found under the participants list, and we're going to unmute you one by one to answer questions. All right, our first reporter we have is Mitch Blocker with NBC 10. You are now unmuted.
Thank you. Dr. Farley, can you tell us, when do you believe that we will start to see, by the number of new cases, evidence that social distancing is working?
You know, I don't know. It's very hard to predict this. A week or so ago, I was asked that question, and I said maybe 2 to 4 weeks from then. So I think it's too early to say for sure now. Remember, there's a delay between when the infection starts to, the spread starts to slow down, and when people get sick, because there's an incubation period of 4 to 6 days. And then there's a delay between when people get sick and when they get tested. And there's a delay between when they get tested and when we get the result. In that case, that could be several days. So it takes quite a while from the time when changes happen out there in the community and when we start to see it in our data.
Are you encouraged at all by any of the heat mapping that is now public, tracking fevers across the country and in the region?
You know, I saw that. It's new data. It's hard to be at all certain how to interpret it. You know, I'm happy to see any data that shows things going in the right direction, but I would like to see data from multiple sources giving a consistent picture before I could say that we're on a positive trend.
And one last question for you. Do you recommend that people wear masks or cover their faces in Philadelphia right now?
At the moment, we're not recommending that for ordinary people. Your average person, it would be for specific situations.
Thank you, sir.
Okay, thank you, Mitch. Next, we have Pat Loeb at KYW. You are now unmuted.
Thanks. I have questions from a couple people. One, will personal protective equipment be provided for police detectives? And in the meantime, or if the answer is no, what should the protocol be for them when questioning witnesses and making arrests and so forth?
So the police commissioner has provided detailed instructions to all of her police officers about how they should interact with the public and with people they're interacting with when they believe someone has COVID-19 or someone has showing symptoms. Officers have been given personal protective equipment, but we are using that sparingly, recognizing that that equipment is in short supply. Detectives have changed their policies, so they're not bringing in as many people to question at a time, and are trying to question those individuals outside, again, to limit the spread of the disease. And certainly, as this continues to develop, we are rapidly providing guidelines. But at this point, I think Commissioner Outlaw's directives are clear to our officers.
And yesterday there was a case in the Juvenile Justice Center of an employee wondering if there are any residents at the facility that have tested positive, and also, if so, how you're getting information to families. Apparently the State Department of Corrections has a website that shows numbers of tests being done in detention facilities and negatives and positives and so forth. Does the city have plans to do anything like that?
So there have been no positive tests of anyone in detention at PGJSC, and we're not confirming staff that have been tested positive or not, as has been our prior posture. As for the number of inmates who have tested positive at our jail system, that number is being posted daily on the prison's blog related to COVID-19. I believe that number is 20 today. 20.
And for Dr. Farley, I've heard that there are, in the maps that the health department has put up of where the cases are, that they're beginning to see spikes in certain neighborhoods. And if that's so, can you talk about what might be behind that and where they are?
Yeah, I would say right now the same thing that I've said before, that we still don't have enough testing in each zip code to have great confidence in the differences you see in positivity rates from one zip code to another. As we get more cases over time and more information in there, we might be able to make more definitive statements, but right now, I think the main message from that map is that the virus is in every neighborhood.
Okay. And just to go back to the prisons briefly, sorry. Will the prisons commissioner be part of the briefings at any point to talk about possibly what's being done to reduce the population?
So I think we can cover some of that right now, if you want, Pat. So,
Thanks.
We certainly recognize that there are calls for us to reduce the prison population, and we're working productively and proactively with our courts to move petitions aggressively through the system to release inmates. We have provided significant amount of data to our defenders and the district attorney's office in order to be able to prepare those petitions, including people, a list of names of folks who are older or may have underlying medical conditions or have served minimum terms. All of that information has been provided to appropriate attorneys in order to file petitions. One of the things that advocates are asking us to do is to, by power of executive order, release inmates that fit certain categories. And after consulting with our city solicitor, it's clear that the mayor doesn't enjoy that emergency power, that the release has to come from the court system. And again, I think we are working productively with the courts to be able to move those processes along. I think on the prison side themselves, I think they've done a good job of making sure that their inmates and their officers are protected. When someone enters into the facility new, that individual is placed into quarantine for 14 days. They've set up quarantine facilities on site for anyone who is displaying symptoms, making sure that they're tested regularly and provided health care. They've also limited movement throughout the facility, allowing people an hour a day outside and limited numbers of groups to be able to do that. So I think we've taken the health department's recommendations seriously, and that's not to say that we couldn't do better. And we actually have, I believe the health department is consulting with the prisons today, if not today. Yes, we're consulting with them today to see if there's any additional protocols that we need to put in place. But we certainly are taking the protection of our inmates and our staff very seriously, and we want to make sure we provide every avenue possible to protect from the spread of this illness.
Thank you very much.
Okay, thanks, Pat. Now we are going to Jacqueline Lee with 6ABC Action News. You are now unmuted.
All right, can you guys hear me?
Yes.
Thank you. Okay, so can you, can someone explain like what is and what is not allowed with social distancing? Like, for example, families can take walks, outdoor exercise is okay, and grocery store visits are okay. Like what is and what is not allowed?
Do you want to?
Yeah, the basic principle is we want people to do it as little as possible. We do say exercise is okay because exercise maintains your health over the long term. But if you're going to exercise, do it by yourself or with just a household group so you're not exposing other people. Maintain your distance when you're there, and you do your exercise and then come right back. And then beyond that, it's only for errands that you have to do. So if you have to go to the grocery store, if you have to go to the drugstore, fine. But otherwise, don't go outside.
Okay, awesome. And can someone from the city outline what requests have been made for PPE and what has been granted? So, what agencies have you guys turned to? Have you turned to private sources? And what's kind of the stance on this, given that states are complaining that they're just fighting for these supplies?
That'd be accurate. We are still fighting for supplies. I do believe a shipment was delivered yesterday from the national stockpile. I don't know exactly what was in that. I think we're still unpacking that now, and that equipment will be distributed as appropriate. I think we have a standing request to PEMA, which would then go to FEMA. For various supplies, and we're sourcing a number of those supplies on our own. And I think the president and Pete Gaynor, the director of FEMA, have been very clear that we shouldn't wait for the national government to come to the rescue with personal protective equipment. And as such, we like other municipalities and other counties are trying to source that material on our own, and we're going to continue to do that and have a number of promising leads, both stateside and internationally, on securing some more equipment.
Do you have specific numbers, like you requested, 10,000 masks from this place or 20,000 from this place? Because you need 30,000 masks a day, correct?
We said, give us all of your N95 masks that you can find. We have not been that specific, but again, the inventory, and I think as I said previously, the inventory stateside is limited if it exists at all. Every city, county, and state in this country is looking for N95 masks. They're looking for hand sanitizer, hospital gowns, surgical masks. All of this personal protective equipment is in need. All of it, the supply chain for all of them is extremely strained. And right now, the only sources we've been able to find are overseas, and some of those sources are less than reputable. And so we're going to continue to vet those sources, and are optimistic that we're going to be able to find additional equipment shortly. And do want to thank 3M and some of the other manufacturers for stepping up production as much as possible. But frankly, the need is greater than the production is going to be able to meet.
Okay, and then last question, turning to food distribution sites, I'm told the Keep the Faith Ministries ran out of food today. Our chopper caught some really long lines and people were quite upset. So what happens if these sites run out of food to distribute? Like, should people go to, there's 40 sites in the city, so should they go to other sites? Are they only allowed to stay in that site designated to their neighborhood? Like, how do they handle that?
So people aren't, there's not a specific site assigned to specific individuals or specific neighborhoods. I think this is the first day that we have expanded to 40 sites, and so we certainly recognize that there's going to be some hiccups, and we're going to be able to smooth that process out over time. But I think those long lines, the fact that we've run out of food, it shows how great the need is. These sites are meant to supplement our existing food pantry system, and we're going to do everything we can to continue to provide sustenance and meals to our city, and would encourage volunteers, staff, and the public to continue to donate to organizations like Fill Abundance and Share to be able to provide this need. It's huge, and frankly, we're not going to be able to meet it by ourselves.
Okay, thank you guys so much.
Okay, thanks, Jacqueline. Now we are going to Laura McChrystal with the Inquirer. You are now unmuted.
Hi. First question is, given the police department policy change to no longer immediately take most suspected drug dealers or buyers into custody, what would the administration say to residents of neighborhoods like Kensington who may fear that this has emboldened people to sell and use drugs out in the open even more?
So first, I would say that we already had a problem in Kensington with people selling in open air. I don't think that's changed. Police officers we have never said that our policy is letting people get away or not prosecuted. We aren't taking those individuals into custody. We're making sure that they're fingerprinted and a subpoena and an arrest warrant is issued at a later date. And the officers always have discretion that if someone is a danger to the community or to the police, they will be taken into custody. Nobody's getting off the hook here. We are doing everything we can to enforce the law. The challenges in Kensington have been exacerbated by this crisis, but we haven't turned our back on Kensington. We're still doing a lot of work there to provide for both those that live there as well as those suffering addiction.
Okay. And on trash pickup, I'm wondering if you could expand a little more on the trash running a day behind. Is that due to workers calling out? Do you have a smaller number of people coming in? And if so, you know, the union representing those workers said they haven't been notified of a high number of call outs that would be causing the delay. So can you just comment on that?
We've had some staff shortages as it relates to sanitation, and we're working with the union to make sure that's rectified.
Okay. Can you expand at all? Are they calling out because they're sick or other reasons?
Laura, you'd have to ask them why they're calling out. I think we're doing our best to make sure that all of our core city services are provided. We're running a little bit behind on trash pickup, but I'm confident that we're gonna catch up.
Okay, and one last question. Are patients from areas that might be harder hit by the coronavirus coming into Philadelphia hospitals? I know Dr. Farley gave some numbers of hospitalizations, but I'm wondering if he has any information on, are those people maybe coming from elsewhere?
We don't have any information on the place of residence of people in the city hospitals. We certainly have heard of some patients coming from elsewhere to Philadelphia hospitals, either on their own or having been transferred. And given the impact of this epidemic on New York City and northern New Jersey, I would not be surprised to see more of those patients in the future.
Thank you.
But also remember that we're a regional medical center, and people who live in the counties and in New Jersey have their doctors that are affiliated with Philadelphia hospitals. So we're going to wind up having people from the region coming to see their doctor or the hospital that doctor practices in. So there's really no way to avoid that.
Thanks.
Okay, thanks, Laura. Next, we are going to Martin Pratt with YBN Philly. You are now unmuted.
Thank you. Two questions. The first question is, do we know any stats on how many people are being reached by the Philadelphia texting service that's being offered to Philadelphia residents to keep them abreast of Corona?
I don't have the most recent number, but we can certainly get back to you, Martin, with that number. I'll have somebody from our comms office circle back.
Okay, I appreciate that. And then the second question is, are there any safety measures being taken for volunteers and workers at the food distribution sites, on site?
Yes, there are a number of safety measures that are being provided. So everyone has been provided a mask. They're provided gloves, food quality gloves. Hand washing stations are present, as well as sanitizer, in order to make sure that they stay protected.
Excellent. Thank you very much.
Yep.
Thanks, Martin. Now we're going to Claudia Lauer at the AP. You are now unmuted.
Hey, thanks again for holding these. I have a follow-up question. Someone yesterday had asked for racial data on the people who have succumbed to the virus. I was wondering if that was provided and if I could get that.
I don't remember if they're getting the request. If I did, then we didn't follow up on it, but I believe we have that, and we will try to follow up with you on that.
Thank you.
Okay, thanks, Claudia. Now we have Jack Tomsic with Metro. You are now unmuted.
Yes, this is for Dr. Farley. You mentioned that hospitals are seeing more and more patients with COVID-19. I was wondering how the hospitals are doing with PPE. Is the shortage getting worse, or is it getting better, or is it getting a little bit better?
I can only say it's very tight. The hospitals are having to be very careful about conserving the PPE we have. They all have some. They're able to use it for their staff, but they have to conserve it because it is so short.
And I know in previous days you've talked about the number of healthcare workers that have gotten this virus. Can you give an update on how many healthcare workers have gotten it?
I don't have that number for you here today, and in part because the cases are coming in so quickly that the information we have in each case is getting less and less, and we're having difficulty keeping up with it. And so I don't want to give you a number that is falsely low. And so I'm not sure if we're going to be able to continue to report that in the future. I believe yesterday we reported approximately 100 known to be healthcare workers. There may be more than that, but I can't say how many more.
Okay, and one last question is about, I know several days ago you talked about a donation program where people can go online to donate PPE. How successful has that been?
So first, before I forget, 74,000 are the number of people who have signed up for the COVID PHL text alert. We want more people to sign up, so please push that out to all your stations and news outlets. To ask your question about PPE, we've received some. I think we've seen some N95 masks come in from various trades and industries that we have then been able to distribute to the hospitals. And we've received a number of kind of handmade masks that can't be used in healthcare settings or for first responders, but could be distributed to volunteers and to folks in less close proximity to others. But again, I go back to this notion is that PPE all over the country is in short supply, and we're going to have to continue to either find a way to be able to reuse it, and I know there's some folks who are working on that, or we're going to have to find other sources.
Right, thank you.
Thanks, Jack. Now we are going to Lawrence McGlynn with Philadelphia Neighborhoods. You are now unmuted.
Thank you. Beyond what is explained in the text of the bill, can you provide any further detail on how the funds in the transfer ordinance will be used?
As we've said a number of times, is that this is going to fund our staff, and it's also going to fund things like quarantine space. And so our goal is to add 750 hotel rooms that could be used for isolation or quarantine space. It'll pay the leases of those hotel rooms. As we build out the Leah Core Center at Temple for hospital beds, it'll pay for supplies. It may pay for salaries of medical professionals who are working there. It will pay for certainly any PPE that we bring in for our healthcare systems, for ventilators, so it's going to, and I actually want to thank the council president and city council. I mean, this is not a usual appropriations bill where we actually have a much clearer understanding of what we are going to spend money on. Things change every day. I did not expect to have to buy refrigerated trailers. We've had to do that. And there's going to be things tomorrow that I didn't expect to have to purchase. And so we need that ultimate flexibility. And so I want to thank the council president, thank city council and their colleagues for being such great partners. And we'll be reporting back to them every 2 weeks on what exactly has been spent and on what.
Thank you.
Okay, thanks, Lawrence. Now we are going to Alicia Reed at CBS 3. You are now unmuted.
Thanks. In regard to the food distribution program, more sites were added since Monday. There was more food available today, but at least one other site ran short. Is it in the budget for the program to continue indefinitely? And is the city ready for the number of families that continue to come out?
As I just said, the food distribution program is going to supplement our current pantry system, and we're going to do everything we can to keep this food distribution system up and running. We recognize that there's some hiccups, and that we're going to need to smooth out those bumps in order to continue to provide food for our most vulnerable. But I'm also pretty realistic. Our biggest limiting factor around this is actually not even the food. It's actually the limiting factor is going to be staff and volunteers. This is going to be a very difficult operation to maintain long term. We're committed to providing it long term, but it is, I'll say it's a fragile operation for a fragile population, and we are going to do everything we can to make sure that we keep it going.
Thanks. With the delays in trash pickups due to employee sick-outs, are the sick-outs continuing today, and are they affecting any other city programs?
My understanding is all of our core services are being provided as scheduled, except for sanitation. And again, we're just saying that we have staff shortages. I'm not sure I would be comfortable calling it a stick out.
On Wednesday, the Inquirer reported that Penn is planning on closing parts of Spruce Street for an emergency field hospital. Can you confirm that they're working with the city on this plan and when it might go into effect?
The first time I heard about that was when I read it in the Inquirer. So we are working with HUP on a regular basis. So I don't know if it's true or not. Again, we are looking at additional surge capacity at both the Leah Core Center and other facilities to make sure that our surge capacity for all of our hospital systems are met. Yep.
Thank you.
So if I can just add on that, all the hospitals have been planning to add beds in their existing facility. And so I'm not sure if that's what that tent was about, but they may be using space that is otherwise unused in a building, or they might be adding a tent. And that's something we've been working with the hospitals on for a while, although all the details are done by the hospitals.
Thank you.
Thanks, Alicia. We now have Shair Arias with NBC 10 Telemundo. You are now unmuted.
Hi, ¿me pueden escuchar? Hola.
Sí, ¿qué tal,
Día de hoy la pregunta es básicamente, hay ciudades que están tomando medidas muy estrictas. Por ejemplo, le están tomando la temperatura a las personas cuando entran al supermercado. También los tapabocas, los cubrebocas son mandatorios. Esa es una medida que la ciudad está considerando debido a que todos los días hay un aumento bastante drástico de personas que están siendo contagiados por el virus y todo el mundo tiene que ir en algún momento al supermercado y tener ciertas necesidades.
Bien, un momento. Given the exposure of people and the increase of cases of infection with the virus, will the city be adopting more strict measures, such as taking people's temperatures when they go out to supermarkets? Will the use of masks be made mandatory?
So the answer to both is no. Taking temperatures isn't terribly effective for most people because many people start the infection with other symptoms other than fever. Certainly, we recommend that anybody who has a fever stay home. There'd be no practical way for us to measure the temperature of everyone anyway. And at this point, we don't think it makes sense we're not recommending that everyone wear a mask outside.
La respuesta a ambas preguntas es no. En estos momentos no estamos tomando la temperatura de las personas porque no es una medida eficaz. La mayoría de gente que tiene esta infección no presenta síntomas de fiebre y si tienen síntomas de fiebre les pedimos que se queden en casa. Por este momento no se está contemplando eso.
Del dinero que fue anunciado hoy, los 85 millones, parte de ese dinero será tal vez alguna parte distribuida a algunas organizaciones que están ayudando a las personas indocumentadas.
Bien, un momento. Out of the $85 million that were approved today, what part of it, if any, is going to be devoted to the needs of the undocumented?
If people come to us for help, we're going to help them. We don't ask for papers. We probably can't answer that question because we're not going to be asking anyone their status. If they come to help directly to us, we're going to help them. If they come for help directly to a nonprofit that's providing assistance, they're not going to ask either. These are human beings who are suffering potentially with the same disease that every other human being in Philadelphia is exposed to, and we're going to serve everybody equally.
Thank you so much.
Muchas gracias. La gente que requiere ayuda no se le va a pedir documentos, de manera que no estamos pidiéndoles información respecto a su estatus. Sencillamente, si vienen donde nosotros, los vamos a ayudar. De la misma manera, si se acercan a una organización sin ánimo de lucro, ellos les van a ayudar sin hacer preguntas. Esta es una situación en la cual los seres humanos se están viendo afectados y son los seres humanos quienes pueden ayudarles. Por lo tanto, no vamos a hacer estas preguntas, sino proporcionar ayuda y servicio. Gracias.
Thank you so much.
Thank you. We are now going to go to Jake Bloomgart with WHYY. You are now unmuted.
Hi there. I just had a quick question. I see on the website that we have a breakdown of the cases by age and gender. I was wondering if we had any breakdown by race.
Yeah, I think I answered that a little bit ago. We have very fragmentary race information. The vast majority of these come from laboratory reports, and we get age and gender, we don't get race. And so we don't want to put up anything there that we don't think is accurate.
Thank you.
Okay, thank you. And now we have a question from Perla Lara with Impacto Media. And I'd like to ask all members of the press, if you have a question now, to raise your hand. Otherwise, we're going to conclude after Perla. Perla, you're now unmuted.
Buenas tardes.
Are you hear me? Yep. Okay. Bueno, gracias antes que nada por la carta que le hizo el alcalde a muchas familias de Filadelfia. Ya está hoy nuestro periódico circulando por 15,000 casas de la ciudad de Filadelfia. Y bueno, he recibido esta semana muchas llamadas de gente de organizaciones, sobre todo del sur, que ellos no tienen organizaciones no profits grandes detrás de ellos, como hemos sabido que Congreso, Concilio, Aspira, están ayudando a su gente, principalmente en el norte, pero ellos me decían que realmente hay un problema de abastecimiento de alimentos en el sur, que no tienen toda esa organización y movilización, porque son organizaciones prácticamente muy orgánicas de la gente, pero no tienen realmente a quién acudir y tienen pues preguntas de cuándo van a llegar los recursos directamente con ellos, porque ellos no saben a dónde acudir.
Bien, básicamente quieres agradecer el que se haya firmado esta emisión de los fondos para apoyar las iniciativas y estás haciendo un contraste entre las organizaciones comunitarias en el norte de la ciudad y la falta de apoyo para las comunidades en el sur de la ciudad con respecto a la distribución de alimentos.
Sí, la carta del mayor que nos escribió al periódico Impacto específicamente.
Bien,
pero lo demás sí es correcto.
Bien. Would like to thank you for the letter that you sent us to Impacto. And I have a question in regards to support for the communities in South Philadelphia. There's grassroots organizations and nonprofit organizations such as Concilio, Congreso, Aspira in North Philadelphia that's addressing the needs of citizens in North Philadelphia. But the citizens in South Philadelphia don't have such non-for-profits to help them, and there's problems with food distribution and access to food. What's being done, what can be done to help the people in South Philadelphia?
Not specifically, I mean, that's what the food distribution sites are for.
Well, I'm not specifically aware of this particular issue, but there are food sites, obviously 40 of them for families and 80 for students. So there's got to be one near you or near people in South Philadelphia, and we can get that list and post it on our website. But this is the first complaint I've heard relative to South Philly.
En realidad es que he recibido...
Perdón, la respuesta.
Perdóname. Sí.
¿Cómo no? No estábamos conscientes de este tema, no sabíamos que había esta necesidad. Tenemos, sin embargo, sitios y centros de distribución de alimentos para familias y para estudiantes, 40 y 80 respectivamente, o sea que debe de haber alguno cerca de las comunidades del sur de Filadelfia y esa información se puede buscar en nuestro sitio web. Vamos a hacer algo al respecto sabiendo que ahora esta necesidad.
Sí, solamente considerar que fueron más de 5 o 6 llamadas de diferentes personas y organizaciones en el sur que nos dijeron que eso es lo que estaban viendo, que realmente no existía la ayuda, no la veían como tan fácil de conseguir y de encontrar, o sea, de ir directamente a donde está la ayuda.
And just to let you know that there was 5 or 6 calls that I received from people and organizations regarding this need and where they have to go or where they can go in order to get this help.
Okay, we'll get an answer for you tomorrow.
Le tendremos una respuesta para usted el día de mañana.
Gracias.
Thank you.
Okay, thank you, Perla. We have our final question today is from Martin Pratt with YBN Philly.
Hi, follow-up question to Dale's question from the notebook. I think it was beginning of the week. Do we have a date or a roundabout date or estimated time where most of the Philadelphia students will have their Chromebooks and the internet, or is it separate? They're getting the Chromebooks and then a week later getting internet, or how's that working out?
I'm not exactly sure how the internet and Chromebooks are being delivered together or separately. I think the district isn't planning to start online instruction, if I recall, until the beginning of May, but we can certainly get additional detail. Before we close, I do want to make one additional announcement, which is that the Citizens Bank Ballpark site is going to close for weather conditions today. The high winds are impacting their ability to serve people being tested. And I was gently reminded that I did not provide the text number. So if people could please text COVID PHL to 888-777. Again, that's COVID PHL to 888-777. Thank you all.
Thank you.